Hi, my name is Christy. Today I'm going to be presenting to you about my patient for my cardiology soap note. So my patient is her initials are AR, and she was seen in clinic on March 11, 2026. Her date of birth is September 25, 1960, and she's 66 years old. She's accompanied by herself, and she's a female. She goes by she, her, and her ethnicity is Filipino. So, a chief complaint is a patient is a new patient seen in clinic with palpitations and needs refill for medication. So, HPI is a 66-year-old Filipino female seen in office who is new, who comes into the clinic with palpitations and wants a cardiology referral. The patient is a sole caregiver for her 90-year-old mother, and she has been experiencing intermittent palpitations for the last 10 days that last about 5 minutes at a time. She does feel like her heart is racing and doesn't know why it's beating so fast, right? Um, she did mention to me that she is getting stressed out by her mother because her mother demands a lot of her attention. She sleeps so late, like around 1 a.m. in the morning, but takes her medications right before she goes to sleep at 1 a.m. She then wakes up around 10 o'clock in the morning, but she doesn't have time to care for herself because her mother wants her to be with her like at that moment. Um, she she monitors her blood pressure twice a day. Her SBP in the morning is around 130s, and in the evening it's around 150s. So, um, she has history of hypertension and hyperlipidemia. She takes her losartan 50 milligrams PO daily, and then her blood pressure, like I mentioned, is elevated. It is elevated at night and is lower in the morning. She seems anxious and reports that she needs respite care, but her mother does not want her to leave her side. Her mother has become more needy ever since her father has passed away 3 years ago, and so the mother is becoming like, needy, but she demands a lot of her attention. Um, she also mentioned to me that like her mother said, let's go to the Philippines for a vacation. Um, she told her mother she doesn't want to go to the Philippines for vacation. She just wants to stay here and take care of herself. And she noticed that when her mother said that to herself, her mother made her feel guilty about it, and then she started having palpitations. So she was just feeling anxious when her mother said that to her about 10 days ago. Um, so she denies any chest pain, syncopal episodes, feeling lightheaded, feeling dizzy, or any shortness of breath. And she doesn't have any non-radiating palpitations that go to her left shoulder. She denies any palpitations at time of visit. She didn't have any episodes of palpitation. So she's not sure what causes the palpitation, but she knows that she is under a lot of stress. So we did an office EKG, and the EKG showed that it was normal. The patient wants a cardiology referral and wants her blood pressure medication to be refilled. So as I mentioned, she's taking losartan 50 milligrams PO daily for hypertension. She has never been hospitalized. She has never had any surgeries. She is has no known allergies. Family history includes type 2 diabetes and hypertension from her mother, and her father has hypertension and CVA but expired in 2023. So her social history includes working as a caregiver for her 90-year-old mother. She was a psychologist before, but then her mother needed her help, so she just works as a caregiver now full time for her mother. So like I said, she doesn't have any time to do any hobbies. She doesn't have any time to do any exercise. She does not have any time for herself, right? Range of ROS, constitutional. She denies any fatigue, denies weight loss, denies fever. She denies any numbness on upper or weakness or upper extremities. Doesn't have reduction in refluxes. She denies any dizziness, headache, lightheadedness at time of assessment. Cardiovascular, she denies palpitation at time of visit. She denies any shortness of breath. And Her vitals include her weight is 140, her height is 5'2", her temperature is 98.5, her blood pressure is 137/89, her pulse is 88, her respiration is 20. Her physical exam include general appearance, awake and alert and oriented times 4, appears well nourished, cardiovascular, regular rate and rhythm, S1 and S2 heard, no murmurs heard, EKG done at bedside, normal sinus rhythm, no palpitation at time of assessment, lungs bilaterally clear on auscultation, neurologic bilateral equals strength, 5 out of 5 strength. Like I said, she appears anxious and she appears restless at time of visit. So assessment includes my first differential diagnosis is palpitation. So the patient is reporting non-radiating and intermittent palpitation many times a day for the last 10 days. So in the office, the EKG was normal, but we are going to order some labs just to rule out any cardiac anomalies, and then and rule out any electrolyte imbalances or metabolic issues. She also has hypertension. So as I mentioned, the patient takes her blood pressure medication at night, right before she goes to sleep, around 1 o'clock in the morning. And she just wants her blood pressure medication to be refilled. But she is at risk because she can be having some low grade inflammation with oxidative stress, which is causing her blood pressure to be elevated at night. And then caregiver burden. As I mentioned, she is the sole caregiver of her mother, and she is stressed out caring for her aging mother. Sometimes she just needs a break, but her mother makes her feel guilty about taking a break. She reports that she's been getting stressed out ever since her father has passed away. She doesn't have time to exercise or take care of herself or do something for herself. She takes her medication really late at night. Since she's Filipino, and I can relate too, because I'm also Filipino, and in the Filipino culture or in most Asian cultures, the children are expected to care for the aging parents. So that's the exception, that's the expectations that are set for in the family. But she's just so stressed because her mother makes her feel guilty about doing things for herself, that she can't even enjoy that for herself. So our plan is to order labs for her. We're going to do a complete lab on her. We're going to do CBC, BNP, MAG, vitamin D, hemoglobin A1C, thyroid, T4 and T3, and with a urinalysis. We're also going to order some troponin and creatinine kinase just to make sure that her cardiac markers are okay, that there's no sign of cardiac disease or arrhythmias going on with her body. Right. We're also going to refer her to cardiology for palpitations so she can get a Holter monitor for arrhythmias. Also, we're going to we educated her to take her blood pressure medications in early evening, probably 6 to 8 o'clock p.m. rather than at 1 a.m. at night. And then to continue monitoring her blood pressure from morning when she wakes up, and then in the evening right before she goes to sleep. And we also educated her on sleeping, on doing sleep hygiene as well, having good sleep hygiene, and having her to sleep at an earlier time rather than sleep at 1 o'clock. And lastly, we also told her to monitor her palpitations and write the frequency of her palpitations, write down what the characteristic of the palpitation is, right? And as we mentioned, we did a 12-lead EKG in the office, and it was normal sinus rhythm in the office. And we just also educated her to do good sleep hygiene. Once she does sleep hygiene, she can wake up earlier to exercise, and she can walk and take care of herself and do at least 30 minutes of exercise per day to help relieve some of the stress. We also educated her on finding respite care and finding community support for her mom. Even though her mom expresses that she doesn't want no one to take care of her, but it's important to have the mom understand that it's important to have the mom understand that that we need to take care of ourselves too. right? And lastly, we also educated the patient on emergent symptoms such as constant chest pain with pressure that radiates to her left arm, syncopal episodes or dizziness, or having any shortness of breath, to go to the nearest ER. If she experiences any of those symptoms, she needs to go to the nearest ER, and the patient understands when she does experience those symptoms. So we'll follow up with her in a week. We're going to refill her medication, her losartan, 50 milligrams PO daily. But we said that when your labs come back, when and then you continue monitoring your blood pressure, and we notice that there's a higher trend, then we will increase the blood pressure medication and to see if that will reduce your blood pressure throughout the day. But for now, we're just gonna have her take it at an earlier time. We're also gonna have her monitor her blood pressure, and then we'll notice a trend when we discuss labs. We'll talk about it when we do labs again next week. So the reflection is that, this patient reminds me of my mom. In 2020, my mother had retired, and so she became the sole caregiver of my dad, right? So when she started becoming the sole caregiver, she was so stressed out because there's a lot of things going on, and she was just so stressed out about everything. Especially, my dad is not an easy person to take care of, right? And so he's very particular, and he's very set in his own ways. But my mom started having palpitations, so we took her to the primary care doctor. We did cardiac workup on her. We did a Holter. She did a Holter monitor for a week, and everything was normal. Everything was fine. Her heart was fine. She didn't have any arrhythmias. She didn't have any electrolyte imbalances. I just told her, you just need to take care of yourself. Take some time for yourself and recharge. And so she's been doing that. She's been incorporating those habits, and she feels a lot better now. She doesn't feel any more anxiety. She doesn't have any more palpitations. Sometimes it could be related to anxiety and stress, palpitations. But first, we need to rule out any cardiac issues such as electrolyte imbalances, cardiac imbalances, or TSH imbalances. So to make sure that there's nothing going on physiologically, and it could have been a psychologically issue. Anyways, that's my reflection. Thank you so much for watching me on my soap note. I hope you have a great day and have a great week. Bye.